Hello, this is Shelby Robinson, and today we're going to be walking through the positive expiratory pressure therapy, also known as the PEP therapy. So first you're going to gather your equipment, so that would be obtaining your PEP device while also setting that up with the pressure manometer in line. Next, you will need to walk into the patient's room, introduce yourself to the patient while also explaining the therapy to the patient and making sure that they are understanding what's about to happen. While you're doing this, of course, you're going to wash and sanitize your hands while also putting on any PPE that might be needed for this patient and for this therapy. So next, after that, you will need to take the patient's assess the patient's vital signs, their mental function. So are they coherent enough to perform this therapy? Listen to their breath sounds and just establishing a baseline for this therapy. Next, you will need to place the do the fixed orifice to the largest setting, and then have the patient sit upright while placing their elbows on the table and making sure that they're sitting upright and that they're comfortable. So after you've done all that, you will then place the mask over the patient's nose and mouth while making sure that it is tight and comfortable for the patient. If the patient isn't able to use the mask, then you will need the nose clips and the mouthpiece. With the mouthpiece, you're going to make sure that the patient is holding that firmly in their mouth and that the nose clips are properly placed so that, nothing is, so the patient isn't breathing in any room air. Okay, so after that, you will then have the patient take a larger than normal breath. So make sure that they're not taking too deep of a breath to where they're filling their lungs up to total lung capacity, just a larger than normal breath. Then you will have the patient exhale slowly. While they're exhaling, you're going to be watching the pressure generated manometer while also decreasing the orifice until about 10 to 20 centimeters of water is being generated. So after that, you will have the patient do about 10 to 20 breaths and 2 to 3 huffs. So you're doing the huffs to make sure that the patient is getting rid of any lung secretions. So just helping the patient get rid of any sputum. And since this is a clinical setting, you will have this patient do the therapy about 4 to 8 times. And also reassessing the patient periodically. Okay, so with that being said, if the patient is producing any sputum, you will have to note the amount of sputum the patient is producing. So the amount, the consistency, also the color. If it has any odor, you would note that. Also, if the patient is producing any blood. So you would note if the patient is producing blood or if they're not producing blood, you will also need to make note of that. So after you've made note of all of those things, you will then chart the patient's results onto the lab report, and then you should be good to go.